Okay, so the abdominal assessment obviously is supposed to be done laying down, but in order to be able to visualize everything, we have the patient standing up. Again, that's not normal. That's not how you do an abdominal assessment, but I just wanted everybody to be able to see my hands. So the first thing we're gonna do is the auscultation. So the auscultation is done next instead of palpation because palpation increases peristalsis and it can give you a false interpretation of bowel sounds when you do get to auscultation. So first thing we do is we start at the right lower quadrant because the ileocecal valve is usually where all the bowel sounds are. They're high pitched and you can hear them with the diaphragm. So usually you can hear 5 to 30 bowel sounds. No need to count them. Just make sure they're there. Okay, so the bowel sounds are present and they're active. The next thing we're going to do is we're going to listen for the vascular sounds. So the first thing we're going to do is we're going to check for the femoral artery, which is in this area. We're listening for bruits, and no bruits should be heard. So now the iliac artery. Now we're going to listen to the right renal artery. Now the aorta. Now the left renal artery. The iliac artery again. And the femoral artery. So normally you're not supposed to hear anything, no bruits, and there was no bruits heard in this exam. So the next thing we're going to do is we're going to do the percussion. So we're going to percuss over all 4 quadrants clockwise in a systematic way. So first thing we're going to do is, and it should be tympanic sounds because the intestines are gas filled. Okay. Next thing we're going to do is we're going to check for the liver span. So in the right midclavicular line, we're going to percuss from an area of tympany, so in the intestines, until it becomes dull. We're going to mark that area. And then from an area of lung until it becomes dull. Now we're going to measure in centimeters. Normal is 6 to 12 centimeters. In our patient, it's about 9.5. It could be longer in taller people and in men. So that was liver span. Now we're going to check for splenic dullness. We'll leave that there. Now we're going to check for splenic dullness. We're going to check in the left mid-axillary area in the level of the 9th to 11th intercostal space. So about here. And we're going to percuss and have the patient breathe in. Breathe out. So the noise should continue to be tympanic. If it becomes dull when the patient breathes in, it's called Castelli sign, and it tells us that the spleen is enlarged. So there is no change in the tympanic sounds with respiration. Next, we're going to do palpation. So first we're going to do light palpation, and we're going to go clockwise. So we're just going to do a light circular motion. and make sure the patient has no tenderness. Is there any tenderness?
No.
Okay. Check for pain and guarding. Again, this is just 1 centimeter light palpation. Next thing we're going to do is deep palpation. So that's 5 to 8 centimeters, and that's also in a clockwise area. So, any tenderness here?
No.
Normally there is some tenderness in the sigmoid colon on a normal exam, but there shouldn't be tenderness otherwise. Next we will do liver palpation. So we're gonna check, I'm gonna usually put the left hand under the back to kind of lift the abdomen, and then the right hand goes in the right upper quadrant facing up, right under the ribs. Have the patient breathe in, breathe out. It's normal to feel the bottom of the liver bump your fingers, but it's also normal to not feel anything. Next thing we're going to do is spleen palpation. So again, left hand over the abdomen to kind of lift, and then we'll put the right hand under the ribs and the left side. Have the patient breathe in, breathe out. So again, it's normal not to feel anything with the spleen. If you do feel the spleen, that means it's 2 to 3 times bigger than it's supposed to be in cases like mononucleosis or trauma. In this patient, I feel no spleen. Last thing we're gonna do in the palpation is the kidney palpation. So we're gonna do duckbill on the right flank area. Push down and have the patient breathe in. Okay, breathe out. It's normal to feel nothing. You could also feel the lower part of the kidney, which is rounded. But in this patient, I feel nothing. The left kidney is not palpable because it is 1 centimeter higher than the right, so it's going to be under the ribs. Okay, so that was abdominal assessment in the adult patient for NUR 3066C. My name is Christine Rincon. Thank you very much.